How to perform a lumbar puncture. The Liverpool cerebrospinal fluid collection system allows you to determine the correct samples to send in the correct order to obtain an accurate diagnosis. The first component of performing a lumbar puncture is determining the lateral plane by finding the superior aspect of the iliac crests. Secondly, find the lateral aspect of the spinous processes. This cross-section of the plane demarcates the L3-L4 position, which can be palpated with the non-dominant hand. Use an alcohol-based sterile cleaning solution to sterilize the skin, such as a chloroprep. Repeat this procedure twice, again with outward spiraling circles. Now anaesthetize the skin using lidocaine, provided the patient has no allergies. Remember to change the needle from that you drew up with. Again, find your position, determining the lateral and inferior aspects of the spinous process. Use a blue gauge needle and insert this horizontally. Remember to withdraw the needle to make sure there is no blood within the lidocaine before insertion. Gradually advance the needle, again always drawing back to assess for blood before insertion. Change the needle now to that of a green gauge. Again, find the position by determining the lateral and inferior aspects of the spinous process at L3-4. Again, insert the needle horizontally and withdraw to determine that there is no blood within the syringe before installation of the lidocaine. 2% is preferable to 1% lidocaine as it results in less subcutaneous fluid accumulation and therefore impacts less on the ability to palpate the space. Allow the lidocaine to infiltrate the subcutaneous tissue. Now the lumbar puncture needle, which is best performed with a two-stage device which contains first an insertion component. Again, find the position and insert the insertion component horizontally. This allows you to pass through the subcutaneous and muscular tissues and through the ligamentum flavum. This now allows you to pass a thinner, much more flexible needle instillet, which results in fewer post-lumbar puncture headaches, as there is less dural tear. Insert this needle a few millimeters at a time, and at each point remove the stillet to assess for cerebrospinal flow. Once you have established that there is a cerebrospinal fluid flow through the needle, remove the stillet. This can be replaced for the short term to reduce the flow. The first thing to do is to attach a cerebrospinal fluid manometer to determine the opening pressure. Make sure that the three-way tap is appropriately assigned before connecting. Wait for the cerebrospinal fluid to rise through the manometer until it is equilibrized. It is normal for there to be some fluctuation with respiration. Rotate the three-way tap to allow the cerebrospinal fluid to exit. Again, carefully holding the cerebrospinal needle, remove the manometer. Collect the appropriate samples in the containers as allocated by the algorithm within the pack. When you have completed this, reinsert the bevel stiletto needle. Make sure this is clicked into place. Take a piece of sterile gauze, remove the lumbar puncture needle, and then the insertion device. The pressure from the sterile gauze reduces the bleeding and post-procedure bruising, and that is how you perform a lumbar puncture.